Okay, so I think we'll get started. Welcome, everyone. Thank you so much for taking, time out of your busy schedules to come and talk about this important issue. We're presenting a report today that we all worked on together. So there are some people here who were involved, deeply involved in that process. A couple of people who couldn't be with us today. So some of you may have seen our report. It was a perfect storm. We just released it on June 12th. And it really kind of, features, describes the experience of one community who went through a particularly difficult experience. And we kind of, we look at kind of how we situate it within the current policy context around harm reduction and consumption and treatment services, and how the decisions that we often make about the lives of individuals who experience homelessness are sometimes a bit different than than the decisions that we tend to make when we're talking about people who are not unhoused. So that's one thing that we want to kind of address. We also wanted to kind of use this as an opportunity to really highlight the divisions that we're seeing in many of our communities around homelessness and substance use in particular. As homelessness is growing across Canadian communities and beyond, we're seeing kind of shifts in how people see individuals who experience homelessness. And I think that that's really kind of highlighted by the findings of the research that we're going to present. So I'm presenting today, but there are several people who have been involved in this research, including Amy Chesney, who is here today, who is a community leader in Kingston, Ontario, and Brooklyn Ward, who is a research coordinator in the Social Justice and Mental Health Research Lab that I direct. And Elham Javadizadeh, who was a research assistant at the time that we were analyzing our data, and Lalu Sarah John, who is also here today, who will help to kind of facilitate the discussion at the end. I probably should have introduced myself. I'm an associate professor at Western University in the School of Occupational Therapy. I'm an advancing Western research chair in homelessness prevention and mental health equity, and I'm the director of the Social Justice and Mental Health Research Lab at Western University. My research focuses on intersections between mental health and poverty. A lot of my research focuses on homelessness prevention. So how can we help people to thrive following homelessness? How can we help people who are unhoused secure housing as soon as possible and then thrive in that housing after? And how can we sort of address this problem of homelessness that we have in the first place? And, it's taken, several decades now to build up. And now we're in a crisis across our country. And I think it's unfortunate that we're seeing, some fatigue around that, because I think when fatigue sets in, our efforts aren't quite as kind of robust. And so I think that's something that we'll continue to kind of grapple with as a society in the coming years. So happy to talk about that at the end if you have an interest in that. I think it's really important to kind of deliver a land acknowledgement and recognize that, the lands on which we're situated are colonized lands. So Sago, Buzu, Gwe, we're gathered here today to talk about poverty and homelessness. And these are issues that disproportionately affect colonized people and people who are victims of colonial practices and longstanding structural inequities. In Canada, in some communities, although, Indigenous persons represent about 5% of the Canadian population, in some communities, Indigenous persons are represented in statistics on homelessness at around 40%. So 40% of people who experience homelessness in some communities are actually Indigenous persons, which is, the irony of that is something that I really struggle with. One way I think of moving forward towards reconciliation is to openly acknowledge this colonial history, and to find ways to do better in the future, so that we don't repeat the mistakes of the past. We're all joining from different geographic locations, but we're all situated on colonized land. I've presented from other countries, and I often have to do some kind of, research to find out who the Indigenous persons were in that, or are in that place. And I think it's something that we, all need to do and have a responsibility to do. So today I join you from South Frontenac, Ontario, just outside of Kingston. I identify as a settler, and with gratitude, I live and work on the traditional territories of the Anishinaabe, Haudenosaunee, and Huron-Wendat peoples. And I also have the privilege of working on the traditional territories of the Chinantan and Lenape peoples. I honor and recognize these nations as the original caretakers of the land on which I'm situated, work, and live. So I hope that you spend a bit of time thinking about the land on which you're situated, and the people that have faced kind of the effects of colonization. So the objectives of our presentation today are really to discuss recent divisions in society related to homelessness and substance use and how those factor into policymaking. And we'll be presenting some research that we did that kind of really illustrates this. We'll provide an overview of some recent policy developments in Canada related to homelessness and substance use, and problematize those policies. We'll present, like I said, research exploring the experiences of policymakers during and following the closure of a consumption and treatment services site that happened before these recent legislative changes have occurred. And when these services were closed, there was sort of a response in the community that I think we can learn from in the present moment. We will also identify some research policy and practice implications of this research, and we'll talk about some strategies for responding to human rights abuses that we're seeing in our communities, and maybe ways that we can work in our own communities to mitigate the effects of problematic policies that affect the lives of unhoused persons. Before we kind of go into this, I think it's really important that we're going to talk about a very sensitive topic, and we're going to sort of talk about an incident that occurred in Kingston, Ontario, in September of 2024, and in that kind of incident resulted in the death of 2 people, and also the assault of another person, a very serious assault of another person. And we just wanted to acknowledge that that there were people kind of who died that we far too soon in their lives and had many years to live. So we dedicate the study to those people, and we dedicate the study to all of the people who witnessed the events, who still carry with them the trauma of that day. We acknowledge the alleged perpetrator, who also died, unfortunately, on May 22nd, 2025, while in custody. We see all of the people that I just mentioned as victims of this critical incident. We hope that the study provides some opportunity to promote community understanding, community healing, and also to open up a conversation with an increasingly divided society. So in Canada, we use this number of 235,000 people are unhoused in a given year in Canada. Statistics Canada talks about 300,000. We know those estimates are really, really low, and that homelessness is growing quite significantly across our country due to kind of policy changes that occurred in the 1980s. There was a time when homelessness was not as visible as it is now. So for those of you who are of a certain vintage, I'm in my late 40s. And when I was a teenager, I grew up in Brantford, Ontario. I would have to go to Toronto to see anyone who was unhoused. And now it doesn't matter what community you're in, homelessness is quite visible everywhere. And so, when I talk with younger people in their 20s, they don't remember a time when homelessness wasn't visible in their communities. And so I think that can give rise to some complacency. So I just kind of I highlight that often when I talk with groups. In Canada, on a given night, there are 67,000 people. So that's just in one night. These are based on point in time counts. A recent report in Ontario identified that there are nearly 85,000 people that were unhoused in 2025 in Ontario alone. So if you kind of like multiply that across the country, you can see very quickly that number of 235,000 is a very low estimate. Even this number is based on point in time counts. And a point in time count is where we go out on one night, and we literally go into shelters and count how many people are there. We approach people in a community, and we count people that we find kind of living in encampments or directly on the street. And you can probably imagine we miss a lot of people who are couch surfing and so on. Some of you are probably quite familiar with this and may have even participated in point in time counts. But would we always know that they're a low estimate? By name lists are also a very low estimate. Because they only capture people who have been connected with services, and people who volunteer, who consented to having their information shared. That report that identified that 85,000 people were unhoused in 2025 in Ontario also kind of warned that without significant intervention, and in the case of an economic downturn, just if you haven't noticed, we're already in an economic downturn, so we can probably rely on this number. But the number of unhoused people in Ontario could grow to 294,266 by 2035, which is a huge leap in prevalence, and something that we should be kind of quite alarmed by. At the same time, we have a drug poisoning crisis, which I'm sure you've heard of across the country. This is a very serious public health issue. I know that there are public health folks here today. There were between 2016 and 2025, there were 55,032 opioid and stimulant toxicity deaths. That's quite a large number of people who have died. Between 2024 and 2025, 16 people died of an opioid poisoning per day in Canada, and 98 emergency medical services calls were made in relation to opioid poisoning. And that equates to 5,840 deaths per year in that year alone, and 35,770 EMS responses in a single year. I don't actually know the cost of an EMS call, but it would be really interesting to kind of like do the math and identify how much this is costing the Canadian economy. In Canada, we're spending $10 billion per year on homelessness in a variety of different ways. So this is a very expensive social problem. We know that drug poisoning deaths are a leading cause of death in Canada. And yet, we have really conflated this issue of homelessness and substance use as though they're one and the same, that everybody who experiences homelessness is using substances. And I think this has kind of given rise to some division in our communities, because we don't see substance use disorder necessarily as a form of mental illness. We look at it, unfortunately, as a choice. If we look at all of the research on substance use disorder, the reason we think of it as a disorder is because there are kind of neuropsychiatric correlates. We know that the brains of people who use substances on a chronic basis are actually, their brains look different. They function differently. So that's why we think about it as a disorder. And 21.7 to 40% of people who experience homelessness live with substance use disorder. So it's far less than what I think we're led to believe. As we kind of like conflate these issues of homelessness and substance use, and as kind of like the problem of homelessness is growing across our communities, especially in an era of income inequality, where we're all, I think, psychologically seeing ourselves as vulnerable. We're also seeing kind of like stigma grow in our communities, and the oppression of people who experience homelessness as growing in our communities. And so we see ads. I don't know if you may have seen this ad on the left. I feel like it's kind of like, some, strange nightmare in which I'm situated. So when I look at this ad, this is what our tax dollars, our provincial tax dollars, are actually being spent on. There was a recent report identifying that the Ford government is spending $10 million on advertising for its own initiatives, including this one that I've shared here. A safer Ontario means parks without encampments. So it's kind of like, creating kind of a sense of fear and increasing division around homelessness in our society. And kind of the policies that our federal and our provincial sort of governments are creating that directly impact the lives of unhoused persons, we argue, is actually a sign of stigma and discrimination. When organizations try to, and we see this in a variety of different ways, so not just in policies that are being created, but when organizations, decide, they're able to secure funding to build a permanent supportive housing complex or transitional housing or whatever it may be, or a new shelter, it's often met with public resistance because this fear has been kind of like summoned up. Sometimes by politicians, sometimes by daily conversations and so on. But, 10 years ago, it wasn't okay to say certain things about individuals who are experiencing homelessness. And I notice now that it's actually people quite publicly make all sorts of statements about people who are experiencing homelessness. And often those are kind of centered around fear and safety. It's the safety of children and so on. In the report that this kind of presentation is based on, we kind of highlight a couple of statements that have been made by policymakers, including Doug Ford. If you recall, in 2024, he made a statement that said where he kind of like provided unhoused people with the advice to get off your ass and start working like everyone else, was one statement that was made. In 2025, Wally Doddridge, Manitoba Conservative Party leadership candidate, joked publicly about releasing polar bears in downtown Winnipeg to address the problem of homelessness in that city. So that's kind of like the degree to which policymakers feel safe in joking about homelessness. It also exists in kind of like, I went to a comedy show, and every comedian, these were very well-known comedians. Every single one of them joked about homelessness to a point where it just kind of like sullied my whole experience of the show. It's not uncommon to watch movies where there are kind of snide remarks made about people who are experiencing homelessness. So it's becoming safer and safer, I think, in our society to make these kinds of discriminatory remarks, which only makes it harder to address homelessness for organizations who are trying to do that work. In the report, we talk about three different kind of concepts. One of the stigma, and stigma is a term that originated in ancient Greece to refer to symbols that were cut or burned on a person's skin to mark them as an outsider, as an outsider due to their status as a slave, or to communicate to others some kind of deviant act that they had committed. And it was really a mark on the body that kind of signaled to everyone to stay away and to avoid this person. And we know that stigma is alive and well with regard to to substance use disorder, to mental illness, other forms of mental illness and homelessness, as in addition to a range of other conditions, social conditions, even poverty, for example. And in the research on kind of like on homelessness and mental health, we talk about two kind of concepts that are informed by stigma, but really kind of focus on the discrimination that is faced by people who occupy certain social positions in our society. So one of them is homism, which is a recent term that was introduced by researchers, that around the stigma of how the stigma of homelessness is experienced by people in healthcare settings and the kind of healthcare that people tend to receive when they're experiencing homelessness. So this comes out of the work of Sarah Canham, who is a researcher, used to be at SFU, but is now in the United States. And it's a specific type of discrimination that is directed towards individuals who are unhoused. So those of you who might work in have any experience with a general hospital, when people who are unhoused go into an emergency room, they often receive very different care than people who are housed. So that's one example of what homism would look like. Even going into trying to rent an apartment, if you disclose that you are unhoused, substance, you might not be offered that apartment. That would be an example of homeism. Saneism is a form of discrimination that is associated specifically with mental illness. And when I talk about mental illness, I also am talking about substance use disorder as one type of mental illness, like schizophrenia or bipolar disorder, or it's another form of mental illness. So in contrast to homeism, saneism represents discrimination that is specifically linked with the presence of mental illness. So stigma is kind of what leads to the exclusion, but homeism and saneism are actually the discrimination that people experience. And we can see that in policy developments that have occurred over the past few years across Canada, that there are certain, that our Ontario government particularly, and I would argue that the Alberta government as well, is trying to sort of like, force their own concept of what they hope for in the lives of individuals who experience homelessness and live with substance use disorder. And I would argue control the behaviors of individuals who are experiencing homelessness and using substances after decades of not providing people with adequate mental health supports and providing funding for substance use services. So in 2024, we saw the Community Care and Recovery Act, this was the province of Ontario legislation, which prohibited the operation of an overdose prevention site within 200 meters of a childcare center or school. So that very act really kind of like puts in our minds this idea that people who are using substances cannot be trusted around children. So it's that kind of like fear mongering that can develop. And this actually resulted in the closure of 10 overdose prevention or consumption and treatment services sites across the province of Ontario when that legislation was enacted. In 2025, we saw the Safer Municipalities Act, where the province of Ontario where it could impose fines of $10,000, or police could impose fines of $10,000 for the use of substances in public places, 6 months in jail or both. So many of you probably remember when this was enacted. So again, trying to sort of control the behaviors of people who are using substances in our communities, and yet, if we think about it as a health condition, without other adequate supports, this is kind of, I would argue quite problematic. In 2025, the province of Alberta passed the Compassionate Intervention Act, providing family members, guardians, and justice officials with the legal heft to impose a substance use treatment order for individuals who are seen to be at risk to themselves or others in relation to their substance use. In 2025, $550 million was provided for heart hubs, which take an abstinence-based approach to substance use for individuals experiencing homelessness. And very shortly after, the Ontario government announced the defunding of consumption and treatment services sites, which many of you are well aware. The date was June 13th, 2026. And soon after Ontario made that announcement, Alberta followed, and then Saskatchewan. So I hope you can see sort of a pattern here where this legislation is kind of like starting to kind of, I would argue ideologically, the ideological orientation of the politicians who are imposing this legislation it's actually informed by ideology rather than evidence. So just to give you a background on the research context, so in 2024, in September of 2024, a housed person entered an encampment in Kingston, Ontario, and allegedly committed two homicides, and allegedly assaulted one person en route to the encampment. And the reason I'm saying allegedly is that the person who was arrested was never actually convicted. So this is kind of like what the kind of just a map of the services in the just if you're not from the Kingston community, it would be maybe hard to imagine what this would look like. So if you look here at the buildings that are outlined, there's a consumption and treatment services site that is basically on the back of the building, and then there's the integrated care hub, which was a shelter, or which is a shelter in the city of Kingston. Both of these services remain open. And next to those services, an encampment had developed. The integrated care hub and the consumption and treatment services site both took a very sort of, compassionate approach to people who were living in the encampment. The encampment itself was not the property of the consumption and treatment services site or the integrated care hub. So just to make that point. So this is geographically how it was, designed. So on September 12th, 2024, we saw this kind of the assaults and the assaults and the homicides occurred. The integrated care hub and the consumption and treatment services site were closed immediately, and a steel fence was erected within days around the perimeter of not just the property, but around where the encampment was as well, a rather large area. And so the integrated care hub, which is the shelter, and the consumption and treatment services site were both closed for a period of time. And the additional shelter beds were made available throughout the city of Kingston. But it didn't meet the capacity of all of the people who were actually cleared from the encampment, because the encampment was also cleared. And the consumption and treatment services site was closed for a 1-month period without any alternative made available throughout the community. The shelter itself was closed until January 6th of 2025. So several months went by before it was reopened, while kind of a reopening plan was developed. At the time of the closure, a security team was installed. The steel perimeter fence, was placed. And after that, even to this day, there's really kind of like a lot of security on site, and also the steel perimeter fence remains around the property. I'm just going to pause for a minute and just give any of the folks who are involved in this research an opportunity to chime in if they would like to at this point. And I'm looking to you, Amy, if you would like to. No? Okay.
I don't think so. No, that's pretty accurate to me.
Okay. So I'll kind of go light on methodology, but if you're a researcher and you're interested in kind of talking about this a little in greater depth, I'm happy to do that at the end. But we kind of when we conducted this research, and I'll just highlight kind of a limitation of this research right away. We deliberately did not interview people with lived experience, because this was obviously a very traumatic event for many people who were involved and exposed to it. And although it was obviously a traumatic for service providers, policymakers, and advocates who were involved, we felt like, people who were unhoused might kind of have experienced this in quite a different way. And we didn't want to interview them and kind of reactivate all of that trauma for them. We did risk doing that, I would say, with service providers, policymakers, and advocates who participated. With people who were, this is a group of people who were housed, who, for the most part, had their basic needs met. And we felt like it was maybe a safer group to interview. And so this kind of research really represents the perspectives of those three groups: service providers, policymakers, and advocates. When we analyzed our data, these were qualitative interviews. So we really asked participants about their experiences, and critical narrative inquiry is a type of methodology where we kind of ask participants to tell a story of some experience that they had, like with a beginning, middle, and end. And then we analyze it in that way as well. So that's kind of how we'll present our findings. We use what we call abductive coding. If you love research and you want to talk about that a little bit more, I'm happy to tell you what that's all about. And we used a program called Deduce to organize our data in that process. Our research question was, what are the experiences and perspectives of service providers, policymakers, and advocates during and following the closure of a shelter and consumption and treatment services site following a community crisis? So what were our findings? So we had 5 different themes that really correspond with a narrative. So we tell the story in terms of the context prior to the incident. Kind of what was it that that sort of what was the community context in which this began, right down to kind of like making meaning in the aftermath. So sort of just like as participants reflected on this experience, what kind of like, how did they make meaning of it now? So I'll go through each of these. But I just wanted to highlight that these themes, as I go through them, I hope you sort of see how they really reveal divisions in the community around homelessness and substance use, and how kind of unhoused individuals who use substances in our communities should be treated. So certainly, there were some kind of disagreements and different ways of looking at things. So the context prior to the incident was that, that there was an undercurrent of disagreement about how the shelter, so the integrated care hub, and the consumption and treatment services site were operated, and really sort of a lot of concerns around a harm reduction approach to care. And the way that this was described was, described by people who held those views, and also people who were, participants who were really kind of thinking about the kinds of viewpoints that they had heard from throughout the community. It also kind of highlights just how morally distressed, service providers are in services and were before this incident even began. And that kind of this resulted in a workforce that was largely weakened, by kind of having to sort of witness on a daily basis people living in states of indignity. So I'll just kind of read out a couple of quotes. But all of the sort of themes are named according to participant quotes. So they were done before it even started, is one quote from a participant. But this first one, I think there was some political motivation that the CTS and ICH wasn't truly supported. It was more tolerated. And I think there were some stronger political factions within the city of Kingston that wanted it closed, not on an evidence basis, but wanted it closed on an ideological argument. And I think there were certainly community members wanting the same. And folks that live close to the CTS or ICH, they work very hard to build those community relationships. And I think sometimes those get strained. And if you do even just kind of an internet search, you'll see that there were a number of media articles leading up to this incident where community members were unhappy with the way that that these organizations were being run. Emily said, there's lots of moral injury going on. I've been in the field for a long time, and I've never seen the rate of burnout that I've seen in the last 5 or 6 years. Never. I've never seen so many workers go off work due to stress, sick leave, PTSD. They're literally just throwing us out to the wolves and expecting us to fix all of the problems. So really highlighting this idea that, service providers, and they talked about this quite a lot in this research, is, being blamed for the state of housing and homelessness services, being blamed for not being able to address the issue, but then also working within a system where they weren't provided with sufficient resources in order to make that happen. So during the incident, it was like a war, like a bomb had been dropped. So some of these are really difficult to hear and to read, to be honest. So I may not read all of them because I find them difficult to read. But the first quote really talks about how there were conflicting accounts of this incident, and that there were kind of conflicting accounts coming from the media. But just kind of like participants talking about how they had to kind of like drop everything and try to respond and make sure that people who were unhoused were okay in the moment. So you can imagine just how traumatic this may have been. Emily, and this quote, I think, is a pretty powerful one and really reveals this kind of idea of division, is our neighbor was recording it all happening in the middle of the street. And then when somebody tried to approach him to tell him to stop fucking recording, he said, "I don't give a shit. I hope they all die." So I think, just seeing and if you've read the report, you'll see that there are some other statements such as that, unfortunately. And you can probably imagine that if you were in this moment, that this would be quite a traumatic event. And And how the community responded was really illustrative of deep stigma, division in the community around homelessness and substance use, and also kind of like the care that service providers have around their work and the love that they have for this population. So I think that really kind of comes through as well. Immediately following the incident, as I described earlier, the encampment was cleared, the shelter and the consumption and treatment services site were closed, and everybody was scattered throughout the city. People who were in the encampment had to find places to go where they weren't necessarily seen, especially if a bed wasn't available at a shelter, or if they were on maybe the denied services lists for different shelters in the city because of past behavior and so on, would have to go, or if they didn't feel safe in shelter environments and they generally tried to avoid shelters, they were usually kind of like, going deeper and deeper into the woods. Andy describes how staff were traumatized, but the population was all traumatized. They saw their friends get murdered and their community locked down. Their community, while rat infested and unsafe, was still their community. And now all of a sudden that community was gone and they couldn't find the workers who made them feel safe or their friends who made them feel safe. So I think it was likely a very, very lonely time for a lot of people. And then participants talked about how, how the response to this particular population was maybe a bit different than how we may have supported another group of people who we saw maybe as more like us, not like them, and that. By providing more adequate supports during this time. So you can't just take something away from people. You can't just take something away from someone, and expect them to just be okay with it. And that's back to how this community, unfortunately, has decided to deal with the people who are unhoused. Just take things away, make it hard for them to survive. Like that's going to help. And then Barbara says, if you had a fire in a house, don't you wrap people around with, what do you need? Do you need counseling? Do you need food? Do you need whatever? Instead of that, this time we just disperse them. Off you go. So in the months following the incident, people just talked about how it just felt like the closure went on for such a long time. And persons with lived experience, service providers, policymakers, and advocates were all deeply traumatized. The participants talked about how the reopening and the shelter and the CTS were kind of, when it reopened, it was kind of, the organization was operated in such a different way than it was previously. And that much was lost, but they also talked about what had been gained. And so they talked about how some benefits to how the services were now being run as opposed to in the past. I won't read all of these, but there were some really, really big changes, and some of them were changes to capacity. The drop-in was often like overflowing with individuals before the closure. With things slowing down, Jane talked about how service providers were able to have different conversations with people. They weren't just in crisis management mode all of the time. And then Alice says, we met so many people who were just deeply scarred about what they witnessed, and they were just terrified to go anywhere close to the hub. So this is the shelter and the CTS. It just took a lot of unlearning and listening to these experiences, because it wasn't because they were afraid of the hub. It was because you go there and it was like an immediate trauma response for a lot of people. So some people didn't go back because it was a place that represented trauma for them. Making meaning in the aftermath was really kind of how participants kind of reflected on these, on their experiences as time went on and after the services had reopened. They recognized how homelessness and violent incidents like the one that we studied in this research they identified them as preventable by providing people with access to needed resources. They talked about how such instances would not occur. And we don't know that that's the case, but I think the point that the participants were making was really that if we provide people with the right resources, that they're less likely to be in crisis and these situations are less likely to occur. So you send them to unsafe places deeper into the woods, to trap houses, to shelters that have bugs, all of these things. And you're just like, no, they're fine. God forbid anything like this were to ever happen again. It's like, don't do that. Don't take things away from people when they've already lost a friend or a family member and they're grieving. They lost the services that keep them alive. It's just like, how do you expect people to just say, you know what this makes me want to do? Attend that housing meeting and go and be very serious about finding housing. And you know what? While we're at it, I'm going to stop using drugs too. This quote, I think, is a really nice kind of quote to summarize, I think, this research in the context of the current kind of policy context as well. And so I just kind of like, we ended the report with this, and I'm just going to end this presentation with this. The simple solution of closing a CTS is not going to fix a problem. The simple solution of moving it to whatever distant street where it's out of sight, out of mind is not going to fix the problem. I think we really need to put our heads together, and it's multi-agency, probably even multiple levels of government that all need to get together. And it's not just within Kingston, but every city where this is an issue, and figure out what to do. And it's such a big problem. There's so much stigma attached to it. I think it's just one of those things that's more easily swept under the rug. And because these folks don't have the political clout or connectedness or means to make meaningful advocacy to move things forward, I feel like we're stuck in this perpetual treating the end problem rather than making meaningful upstream preventable measures that we don't ever get to the solution. And I just think it's so well said. So that was one participant named John. His pseudonym was John. It's not his real name. So just in conclusion, the stigma of homelessness and substance use disorder are evident in recent policy shifts across Canada, and in the response, I think, to this incident. Our findings reveal deep divisions in our communities related to homelessness and substance use disorders, and closure of CTS services really doesn't make homelessness and substance use disorder disappear. It actually makes things more difficult. There's so many things I could say about this in the context of this city and beyond, but I'll just kind of highlight that the people who were working at the consumption and treatment services site during this time, we actually didn't see a decrease in an increase in overdoses like people were, concerned about when the consumption and treatment services site was closed. But the staff in that organization actually went out and took on an outreach model and found people in places where they knew they were kind of like sleeping outdoors, made naloxone kits available, made sure that people were trained, made sure that people knew where to go when they got into trouble and so on. And I just wanted to highlight the incredible work that wonderful people in our communities are doing every day and working around all of these kind of problematic policies. I think, so that I'll just kind of leave it there. Just kind of like share this slide. If you haven't accessed the report, please access it. I think, if you go to the findings section, there are just some really important contributions that have been made by people who are participated in the research. And I think it really sort of speaks to the experience of this event and also some of the, stigma and discrimination faced by unhoused individuals that they witness every day. If you want to reach out to me at any point, you can by sending me an email. My web address is here. It's SGMH Lab. We put all of our reports there and research that we publish, media and that sort of thing. And so that's kind of what we had for you today.